And next on CBS, reading, writing, and Ritalin. The search for ways to treat attention disorders in children without powerful drugs.
The green one that you're looking at?
Tonight's Eye on America is the second of two reports in depth about the 2 to 3 million American children diagnosed with hyperactivity and attention disorders. Many of these children, even preschoolers, are put on powerful behavior drugs. But now there's a growing demand for alternative treatments. CBS News medical correspondent Elizabeth Callahan has been investigating.
Like average 9-year-old boys, Christopher Shanta is non-stop action. But when it came to school, his ability to sit still was not average.
Christopher was falling behind in classes. He had a problem, difficulty reading, doing math, concentrating.
The teacher is up at the board, and then I read something, and I forget what I read 5 minutes after.
His parents, Karen and Stephen, were told he had attention deficit disorder and that the drug Ritalin could solve the problem. Without hesitation, they said, no way.
I was dead against it, and Karen was also.
It doesn't cure the problem, it only hides what's there.
Parents of children with attention deficit disorder have few treatment options. Doctors say drugs like Ritalin can have an 80% success rate, but they can also mean keeping a child medicated for years. Christopher's parents went looking for an alternative.
Now, here's a book.
What they found was neurofeedback.
What happens to children with attention deficit disorder is they have a dysregulation of their brain function.
In the first of what will be about 30 sessions, Dr. Michelis and his colleagues will attempt to help Christopher re-regulate his brain function by controlling the brain waves that disrupt his ability to focus.
Is that gonna hurt?
No, it's not going to hurt at all.
Using only his powers of concentration, Christopher must keep the middle spaceship ahead of the other two. If his mind wanders or he fidgets, the other spaceships gain ground, meaning that the same brainwaves distracting him in class are taking over.
It's a skill that they learn just the same as riding a bicycle or learning to play a sport.
Ready, Kyle?
5 months of neurofeedback appears to be working wonders for 8-year-old Kyle Lapidus.
He reads more books than I've ever seen him read ever since he started school, and his grades have improved immensely.
Michelis' team has treated about 400 patients and claims an 85 to 90% success rate.